This podcast is a production of WCWP, LIU Public Radio. Check out our lineup of original programs, listen live, or support by visiting WCWP.org.
The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Project Independence and You Talk Radio. I'm Rebecca Miller. I will be your guest host today for the show, along with Otto Lohse, who is the co-host. How are you today, Otto?
I'm good, Rebecca. It's always a pleasure being with you.
It is with you as well, Otto. Today's show is going to be a lot of information, very important information, timely information. We're going to try to understand it. We're talking with Fatoullah, who is an elder law attorney and a really good friend to Project Independence, always providing the latest and greatest information. So welcome to the show, Ron.
Thank you so much, Rebecca. It's a pleasure to be here. And there is so much information out there and changing rapidly.
It is changing rapidly, and especially during the pandemic. So there's been some changes, some exceptions, all kinds of things happening. So let's try to get a little understanding of the topics that we're going to be talking about today, which is how long-term care planning has changed and what you need to know now. So, you do talk a lot about the 5 most important documents, especially now during the pandemic. So let's just get, right into what those documents are. And if there is kind of like, I want to say a priority of which really is the truly most important one, and then we'll kind of move around from there, just like in terms of today's scenario during the pandemic.
Sure. There is an order of priority. And, with so many people that we know passing away, I don't know if you guys know it, but I did mention to you prior to the broadcast that my brother passed away just a couple of weeks ago, but also my receptionist at the office passed away from the virus, as well as her husband. She had worked for me for 18 years, and it was such a blow to the firm. But people, myself including, and I think everyone has been touched by these crazy times. Either by the virus directly or indirectly. I think my brother should have had more care or different care, but it was in the heart of the virus.
Right.
And, the hospitals were not geared up for anything but the virus. They were going crazy at full capacity. So there's been so much going on. So people really do need these documents. And I think if it was a thought before, now they know that these are really a necessity. So we've all seen people passing away recently, becoming ill. And I did get a call from a very close friend of mine in April during the heart of the pandemic. And he said, Ron, you always told me about documents I needed. My wife, unfortunately, got the virus. I don't have it, but she's at the hospital on a ventilator. I don't have a healthcare proxy. I don't have a power of attorney. She has a business. What are we going to do? Please guide me. So if I may start from there.
Yes,
so,
please.
Number one, everyone should have a healthcare proxy. That's a document where you appoint someone else to make your healthcare decisions. I'm an elder law attorney, and I'm telling you, you don't need a lawyer to have a healthcare proxy. You could download the form from the Department of Health website, or even Google statutory New York healthcare proxy. And it's a good document, very simple to fill out, but you want that healthcare proxy. It's very important. However, I also want to mention that if you don't have a healthcare proxy, and a loved one is in a facility, whether it's in a hospital or a nursing home, we have in New York State the Family Healthcare Decisions Act. Dick Godfrey, from the New York State Assembly, worked for about 17 years till he got this passed and signed. But if you don't have a proxy and a loved one is in the hospital, there's a pecking order. And the order lists who can make your healthcare decisions for you in that situation. So it's only when someone is in a hospital or a nursing home, a facility, or at home on hospice. So if you find yourself in that situation, there's a fallback because the government says, New York State says that a close family member, it's the spouse, a child, parent, a sibling, and it even goes to a close friend, can actually make your healthcare decisions. And if they don't know what your decisions are, decisions that will be in your best interest. So the healthcare proxy, just have it done. It's simple. You don't need a lawyer. You need 2 witnesses. Those witnesses should not be any of the proxies or agents that you name, but there's no notary even. It's very simple to fill out. Everyone should have a healthcare proxy. There's no excuse. You could download it now, fill it out, and you'd be set, and just sign it in front of the 2 witnesses.
And could you just mention what that other process is if you did not do the healthcare proxy?
Sure. And a loved one is in a facility or at home on hospice. It's called the Family Healthcare Decisions Act. And a lot of people don't know about it.
No,
but that kicked in for my friend whose wife was on a ventilator at Southside. And, at least he knew he could make her healthcare decisions. So there is a fallback, but not when you're at home and not on hospice.
Right.
So you do want that healthcare proxy. It's very, very important.
Ron, how does that work? Like, who all of a sudden my daughter or whoever can become my agent, if you will. How does it get decided? I mean, you can't pick anybody because you're sick.
You're saying if you don't have a proxy?
Right.
Yeah.
Oh, okay. Yeah, there's a pecking order, and it's pretty loose, and the hospitals know about it. So my friend was so concerned. Well, I didn't do the proxy. We were a little superstitious. By the way, don't be superstitious, anyone out there. Doing your documents doesn't bring anything on. It only protects you when something might happen. But Otto, if that's the situation, the hospitals, the nursing homes know about it. And if not, you just cite, there's the New York Family Healthcare Decisions Act. I'm the spouse, I'm a parent, I'm a child, a sibling. We have the right to act. And it even goes, as I mentioned, to a close friend for families that, individuals that really don't have families or close family. Mm-hmm. So it's there, and the facilities know about it.
That's good to know about because unfortunately, a lot of things that happen in life, like your friend with his wife, I had an experience with my son-in-law's father during this period of time. And all of a sudden, last minute, he's 97 years old. He had nothing. And all of a sudden, they were going to try to put him into a nursing home. He definitely qualified for Medicaid, but he never applied. So it was a crash course. Unfortunately, he died before that part of it took place. But what it taught us is, it's the last minute stuff that causes a lot of havoc. And
Otto, I'm so glad you said it. It is the last minute stuff that causes all the havoc. And I always keep preaching, plan ahead, yes. Get your documents done, get your plan done, and forget about it. But a lot of people, this friend was very close, and he said we were just a little superstitious. We were doing fine. And then all of a sudden, boom. So you're right. Don't wait.
Yeah. I mean, good things can come out of this experience with the pandemic. It's that you need to start planning. We need to kind of have a plan in action, because anything could happen so suddenly. And we did, like, I know Otto and I talk about this a lot on the radio show too, is how when Sandy hit, we did learn a lot from Sandy. It's like we go from having power every single day to maybe occasionally losing it to having no power. So much damage, seniors, unreachable, can't contact their family members, don't drive, and that really helped, Project Independence to like expeditiously, progressively change our programs or have a backup plan for when things like this happen. So I think that this is going to be a lesson for all of us, that we all really need to plan. The worst time to have to do these things are when you're in these situations. Do you really want to have to make all these decisions and choices when you've got a loved one sick, and maybe you can't even in these situations get to the hospital to see them or talk to them. So it's so important. And superstition aside, you can still be superstitious and do this,
Right. That's true. And the healthcare proxy is just one document.
Right.
You would be doing a Medicaid application, et cetera, and things like that. You would need a power of attorney also. That's a planning power with extra provisions in it. And the elder law attorney, such as myself, should draft that, because there's too much going on. We would need to add about 40 or 60, sometimes even 80 additional provisions into that power to give it teeth. So you would want the attorney to handle that. And you should know that there's a new power of attorney proposed law that was passed by the New York State Assembly and Senate and on the governor's desk to be signed or vetoed. And all of a sudden, coming out of the woodwork, there are organizations that are now coming up against it. So we don't know if it's going to be signed, but no matter what, just do that power of attorney now, have an elder law attorney drafted for you with all the extra provisions that you need. And I do want to make mention that, these documents are essential along with your last will and testament. And if you're going to do the planning, likely a living trust. But the question that I get asked so often is, well, how are we going to do this during the pandemic? And I do want to make mention that the governor has signed executive orders, so many executive orders, but a couple of them let us do remote executions of documents, remote notarizations, and remote witnessing. And there's a procedure that we have to take, but I do want to let everyone know that all of these documents, including your will, can be done remotely. You could be sitting in your living room and everything could be signed, sealed, delivered, notarized, and witnessed, even though you're alone in your apartment or home in your living room.
You know what? That's going to be great. We're going to talk a lot more about that, but right now we have to go to a short break. You've been listening to Project Independence and You.
Aging in Place initiative of the town of North Hempstead. One of the many services we offer is help at home with minor home maintenance. Call 311 or 869-6311 to get more information or receive services.
So welcome back to Project Independence and You. We've been talking with Ron Fatoullah, who is an elder law attorney, and again, a really good friend of Project Independence, always willing to assist and give us information, such timely information. So right before we went to break, we were talking, we were kind of continuing in the talk, and I had to kind of interrupt you. So let's go back to the topic at hand. And, we started out talking about like prioritizing these 5 documents, and then talked a little bit about, the documents that don't need an attorney and documents that do, and some of the virtual stuff that people can do remotely at home, which is kind of where we left off.
Right. Well, they're all important in their own way, but as far as prioritizing, the healthcare proxy is where you appoint someone else to make your healthcare decisions. You don't need an attorney, and it's a crucial document. So number number two, not in order of priority, but that's connected with the healthcare proxy, is a living will, a document where you set forth what your healthcare wishes are. The attorney could draft the document as well, but that's a document that I don't believe that you really need an attorney as well, or it's not quite as crucial. But the other documents, you really should have an attorney for. The healthcare proxy, and Otto had mentioned there's a companion rider to that power of attorney. There's a companion rider to the power of attorney, and that's called the statutory gifts rider. Without that statutory gifts rider, the power of attorney would only permit gifting or funding of a trust, let's say, of $500 a year. Well, you can't protect assets with only $500 being able to be transferred a year. So we have this rider called the statutory gifts rider that gives the ability to make, if you want, even unlimited gifts to protect assets. So gifts, transfers, and with the statutory gifts rider, we could actually then fund the trust that could be created. So if we have a very good power of attorney with all the bells and whistles that the elder law attorney would draft, that agent on the power of attorney, even if the principal is on a ventilator, well, that agent on the power of attorney can create a trust, fund the trust, do almost anything that the individual could have done herself or himself financially. And if you have the healthcare proxy, that will take care of the healthcare decision making. And so these are the core documents that everyone should have for sure. And another document is a will. You know, obviously where your assets go when you pass away, it's your will, your living trust, or assets go via beneficiary designations on documents. And I do want to make mention, there's one myth that I want to dispel. I bet that 75% of you out there know it, but 25% may not know it. You could say whatever you want in your will, but if you have a bank account, a brokerage account, you have life insurance, an IRA, and you name a beneficiary, that beneficiary designation takes control over the will. You could say your will, say, I give everything to my son A. But if your beneficiaries would be your daughter B, everything will go to your daughter on those assets. So everyone should just make sure they know that. I know most of you do, but in my experience, some of you just don't.
You know, I mean, that makes sense. I never thought of it. So if I have my sons as my beneficiary on my deferred compensation, but my will, you know, has my future husband on there or someone else, a sibling, it doesn't matter because it's what I put down as my beneficiary.
That's correct.
On that deferred comp. Okay.
That's correct.
Okay.
Right.
Now, there are some cases where you can't really have a beneficiary for a house that I'm aware of. You can have a beneficiary for a lot of bank accounts that I'm aware of. Or if you can, it can be like one or two or whatever. If you happen to have a large family like I do, it's a problem. So these things end up, I guess, in your estate because you don't have a beneficiary. And like even a stock trading account, if you will, you can have a beneficiary, I understand, for that. But sometimes people don't think about setting up a beneficiary. So that goes into your estate as well. Am I on the right path here?
Well, Otto, it's very astute what you said. I mean, yes, you are. Most bank account, virtually all bank accounts, you can name a beneficiary. But if you do have a large family, it gets quite clumsy, you know, when you're doling out your assets. It's always better, in my opinion, most people should have a good trust and a will. But the beneficiary designations on bank accounts, you know, you can do that if you want to, and brokerage accounts. But you said, what about a home or a co-op or a condominium, you don't have a beneficiary on that. And yes, that will be part of your probate estate. And one good way to get around that is to transfer that into a trust, whether it's a home, co-op, or condominium. And if you want to take that extra step and protect it from long-term care expenses or do some Medicaid planning, we could set up a trust that also shelters assets for long-term care and also avoids probate. And so you don't have to worry about those assets as well.
Well, the beginning of the discussion, the goal, I think, is we have wills and we have all these things, but the one thing we don't have is how are we going to handle a long-term problem? You get sick, and maybe you need help at home. Maybe you pass that. Maybe you can go to assisted living. Maybe that's no good. Maybe you have to go to a nursing home. And I know in the back of my brain is, and a lot of people in my age bracket, well, now what? Who needs to, or who can even think about planning, like Medicaid planning or whatever? I don't think everybody would be eligible. Like, there's a lot of people in the middle of the economic world. People who are rich can afford to buy and go to wherever they want because they can afford to pay for it. People who are on the lower end of the spectrum are probably going to have a good crack at making Medicaid. And then there's a lot of people right in the middle who can't really get to Medicaid, and Medicare is not going to do anything for you. So I think there's like a big, there.
Yeah. We talk about the donut hole for Medicare, right? So, but there is that big hole there. You're right, 100% right. If you have millions, you could do whatever you want. If you're, you're poor and you don't have much in the way of assets at all, you're going to get Medicaid. It's going to be pretty simple. It's the rest of us that really need to plan. And the law is changing dramatically with regard to Medicaid and planning. And there's a window of opportunity to plan, which we just found out a couple of weeks ago when the Department of Health actually clarified the law that passed in April. In April, we knew that for Medicaid home care, we knew that there will be, it's not here yet, there will be a 30-month or 2.5-year look back. Right now, for Medicaid home care eligibility, there's no look back. We could simply have a client, if they have 100,000, 500,000, transfer those assets into a trust or even to the children, but there's an advantage to the trust, but transfer those assets out. And as long as the assets, let's say they do it today in August, if their assets are under the Medicaid asset level, 15,750, as of September 1 or the first day of the next month, they're eligible. They could transfer anything and be eligible the first day of the next month. But in April, the governor signed, right in the heart of the pandemic, when we were really hit, it's like a 1-2 punch, we were hit with a 30-month look back. Now, the law said that the look back will start as of October 1 for Medicaid applications in as of October 1, but that the state could delay it for up to 90 days. We just found out 2 weeks ago that they were delaying it. They are delaying it so that now it's not October 1, it's for applications in as of January 1, 2021. However, they kept the October 1 deadline and said, yes, as of January 1, 2021, for those applications in on or after that date, there will be a look back for Medicaid home care. But the look back will only go to October 1, 2020. So to explain that, a little easier, if you apply for Medicaid after January 1, there will be a 30-month look back that will be phased in. We now know, this is new, will be phased in because they're only going to look back to October 1, 2020. So if you apply in February of 2021, they're only going to look back to October 1, 2020. Next August or September, only going to look back to October 1, 2020. So what does that tell me as the attorney? It tells me that we have this 1 month window of opportunity for everyone if they want to do the planning, and I think lots of people should. It's a freebie. It's a window of opportunity to plan, transfer assets, set up that trust. Time is getting very short, but it's still doable because they're only going to look back till October 1, 2020. We're not there yet. So any transfers of any amount for Medicaid home care, if it's done now, well, whether the application, whether you need home care in January or next December or in 2 years from now, anything you transfer now will be not looked at by Medicaid. So this is a freebie. And this window of opportunity will shut at the end of September 30th of 2020. So that's creeping up on us. It's a few weeks away. So I'm so glad that you invited me on the show because I just want people to know. I want people to protect their assets. And we do have this window of opportunity.
Well, when we come back, we do have to take another short break. We definitely need to explore this a little bit more, but thank you so much for providing all this information. It's so important. And we will be right back to Project Independence in You.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include nursing and social work services. Call 311 or 869-6311 to get more information or receive services.
And welcome back to Project Independence in You. We're just going to go right back to speaking with our guest today, Ron Fatoullah, who is just giving us so much information. And we're really grateful for all of this information. I know over break, Otto, you were mentioning you had a question, so I want to go right to you.
Yeah, I'm looking at this from like who the prime candidates right now who should be going full steam ahead to catch up with this opportunity.
Yes.
Like, if you have some money, where do you have to fit in the pecking order, if you will?
Well, a lot of people will fit into this, category of individuals who should plan. Look, I believe that everyone should have a long-term care plan in place. Because of what I do, I went out at a young age and I bought long-term care insurance. Boy, is it expensive. And the company raised my rates significantly and actually doubled the premiums. But for me, it's still worth it. So I don't have to, so I'm not in that category because I have very, very, very good long-term care insurance, about $600 a day of coverage, which is as much as anyone is going to get because I see these things day in, day out. So I'm not in that category. But I would be in that category if I didn't have long-term care insurance that would cover me. So I would say anyone that has an illness that they know about, like MS, even at a young age, or a diagnosis of something that might create a chronic long-term care event, or, and I'll just say this, fairly loosely, anyone who's around 60 or older, 55 or older, should have some plan in place for long-term care, whether it's buying the long-term care insurance, although I do know that it's very expensive. And if there's an illness such as dementia or MS or Parkinson's, you're just not going to get it. And it's quite expensive. But that's another way to plan, or to transfer assets into a trust. Now, we still have a 5-year look back for nursing home care, and transferring assets in a trust doesn't do away with the look back. So you still want to plan in advance because you never know when you might need, care in a nursing home. But most of the people I speak to say, well, nobody wants to go to a nursing home. They want to be taken care of at home. And we never had a look back for home care. So a lot of people came to me, a lot of clients came to me and said, we're going to do all the documents. I'll do the trust. I'll do a little planning, but not a lot of the planning, because I know that I could always gift away my assets and fund a trust the month before I need home care and go on Medicaid right away. And that has been true for decades. However, we now know, as I stated before the break, it's only gifts, transfers, and funding of trusts prior to October 1, 2020 that will create zero look back. If you transfer assets or fund a trust starting October 1 or later, you still should do it. Better than doing nothing, but just know that there will be a look back. Medicaid, even for home care, will look at that and see the transfer. However, even if you don't do the planning now, which is such a freebie and you'll be set, period, even if you do it after October 1, at least you're getting that 30-month look back for home care. You're getting it going already. And hopefully you won't need the care for 2.5 years. And hopefully you won't need nursing home care for 5 years. But the faster you plan, the faster you do it, the faster the waiting period or penalty period will be over. But again, all I'm saying is for Medicaid home care, any amount that you have, not saying you should do Medicaid planning for someone that has $1 million, but by way of example, even if $1 million was transferred into a trust today, Medicaid won't see it, won't ask about it. It's legal. You could get Medicaid home care right away if the transfer was done and the trust funded prior to October 1.
Ron, we talk nursing home or home care, and then I hear assisted living a lot of times. Where does assisted living fit into the scheme of things? Is it, anything that Medicaid would cover or?
Okay, yeah, very good question, Otto. And a lot of people are confused by that because almost all assisted living facilities are private, and you have to pay for it. And it's not a small amount. There are some in Nassau and Suffolk counties, but in Nassau County, by the way, I live in the town of North Hempstead myself. And there are some right here that actually do have ALP beds, ALP, assisted living program beds funded by Medicaid. So we have some of these in Nassau County, and they're actually not bad at all. They're good facilities. May I mention one name or?
Yeah.
Okay. One that I know of and referred lots of clients to, Medicaid funded, the entire facility has all ALP beds, assisted living program beds funded by Medicaid, and that's Amber Court. And that's right in Westbury, I still keep it, Westbury Music Fair. It's not that anymore. It was.
We all do.
But I forgot that the Theater in the Round, right next to the Theater in the Round in Westbury, is Amber Court. And they just redid that facility. I don't get any commissions for saying this.
So Ron, do other facilities have ALP beds, but also not ALP beds? So
yes. It's funny the way this works. You could have an assisted living that has private pay and some ALP beds. Might have 26 or 50 ALP beds. So I'm not sure how, I only represent the consumer. I don't represent the facilities. I don't know how they get those licenses, but yes, that's quite, that happens quite often as well.
Interesting.
And by the way, oh, I'm sorry. I just so I don't forget, the Medicaid eligibility rules for assisted living is actually not what you may think. it's not the 5-year look back for nursing home care. It's actually deemed a community-based service. So it's no look back if you transfer right now till October 1, or after October 1, 30-month look back for applications in as of January 1, 2021. So it's community-based. Rebecca, I'm sorry, it just came to my brain.
No, that's fine. That's fine. I just wanted to go back a little bit when we're talking about the look back for home care. We know what you had discussed. What are the income levels that people should be kind of drawing down to or putting in a trust, so that what are the safe numbers, and what's that all based on?
Sure. Well, actually they do it, Rebecca, by an asset level. And you're eligible for Medicaid home care if you have assets of $15,750 or less. And then there are other exempt categories. One exempt category, and a big one, are retirement accounts in payout status. I brought the case that actually changed that law in New York State with the Queens case about 15 years ago. But retirement accounts such as an IRA, or if you were a teacher and you had a retirement account with UFT, et cetera, all of those retirement accounts are exempt for Medicaid if they're in payout status. You're getting distributions. However, Medicaid always gets their pound of flesh, and the distributions, your required minimum distributions, and now Medicaid actually has a life expectancy chart where they actually calculate their distributions. And for Nassau County, they actually use this chart that creates more income than just your minimum distributions from the IRS. So it's a little bit more in Nassau County for Medicaid, but that income is budgeted as income. So Medicaid actually looks at your assets for eligibility and then looks at your income to see what you can pay, from your own income to go towards your care. But when it comes to Medicaid home care, we have something known as a pooled income trust. And that pooled income trust was created by a charity, let's say by NYSARC, or the UJA has a pooled income trust, where your excess income, we call it surplus income, over the income level of $895 of income a month, can go into this pooled income trust and then used on a monthly basis. So you could pay your rent, you could pay your mortgage, your HOA fees, your PSEG, it's not LIPA anymore, it's whatever it is. And I pay it myself. Yeah, exactly. Your cable bill. So your surplus income could go into this pooled income trust. We don't do this in advance. We only do it when we do the Medicaid application later on. And a big question was, are these pooled income trusts going to be good starting January 1? That was a huge question. Just a couple of weeks ago, the Department of Health said, yes, we're going to permit pooled income trusts. But now the water's a little murky here. We could use the pooled income trust, but we have to be very careful on how we fund it. When there's no look back, you could just fund the trust as much as you want. And if there's extra money in there, it doesn't matter. And if you die with the money in that trust and you didn't use exactly all of it, it just goes to the charity. Well, that's okay. But as of January 1, if you use a pooled income trust and you don't use all the income, Medicaid is saying that's a transfer of assets and will create a period of ineligibility where they're going to kick you off the rolls. And they haven't even come forth with clear regulations on how this is going to be regulated. What are they going to do? So we do know that you're going to be able to keep your income to pay for all of your expenses, but we also know how we maneuver the system. You know, when we as a firm do the Medicaid applications and we tell our clients, well, just use the pool income trust, we do some of the legal work and they're on their own, I think those days are going to be gone because, again, the waters are murky. We can only fund that trust in a very measured way.
You know what? Let's continue with that. We do have to take our final break. Speaking with Ron Fatoullah, we will be right back.
Project Independence is the aging in place initiative of the town of North Hempstead. Some of the many services we offer include fitness classes, community education, information, and referral. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Project Independence and You, right here at WCWP.org, 88.1 FM on your radio. We are now coming into the last segment with Ron Fatoullah. We've been talking to him for 45 minutes with just amazing information. We're going to dive right back into it. But just in case we get to the very last minute and we don't get to thank you, Ron, we want to thank you so much for joining us today. I'm sure we'll have you back. And, you know, from all of us, you've had a lot of loss and, you know, we're all very sorry. And we're so happy that you came to the radio show, you know, to provide this information that's so important right now. So we're really grateful. And, you know, you have all of our love and from our family to your family, all of the support.
Thank you so much, Rebecca.
I'd like
really
one
do
editorial comment as well. The more I learn, the more I know I don't know, and the more I realize that people like yourself who are professionals in this world are very valuable and needed, despite what the image might be in some cases, all right? So the bottom line is I appreciate the fact that you know, in preparing for this, I realized that I really don't know very much, that there's so many little angles involved here. We're just touching on the surface. And if you get down into the gutter, if you will, there's a lot of detail involved and you need people who know what they're doing, my opinion.
Thank you, Otto. Yeah, and it's true, we are touching only the very top of the surface and it's complicated enough. And the bottom line is that even I don't know what's going to come down as of January 1. There are proposed regulations, some of which I think are unconstitutional. I mean, we don't really know what's actually going to come down and how things are going to actually look. But what I'm saying is what's on the books now and what the Department of Health in New York State has told us.
Could we clarify one area we talked about offline? Is the income categories that are involved on a top level for Medicaid applications. We talked about the fact that your income as you get older, you could have Social Security, you could have a pension, and you could have required minimum distribution, which is taxable from what you said. All three of those count as far as income goes. So if you have the good fortune of having income in those three categories, you're probably not a candidate for Medicaid. And I think that's probably important.
Yeah, well, Otto, that could be true, and maybe it's not true. So it depends. You know, if you need 2 12-hour shifts of home care, the cost is actually greater than that in a nursing home and could cost over $15,000 a month. So even if you have Social Security of $2,000 and you have a pension of $1,000 or $1,500 and maybe RMDs required minimum distributions of another 1,000 or whatnot, a few hundred, you know, you still may want to apply to Medicaid because you have a big care need. But on the other hand, if you have a huge pension, you maxed out on Social Security, and you have large distributions on your retirement accounts, yeah, you could be financially eligible to get Medicaid because your assets are at or below the $15,750 level, but it won't make sense to apply because you have all of this income coming in. So that's true. It depends on the circumstances.
That's good.
Yeah, thank you. So I don't know where you'd like to go from here, but I do want, is it okay if I just mention something about the new changes to home care that we know?
Yeah, and
Okay.
yes, absolutely.
Because if you think things were easy then, and I'm being facetious, they're going off the charts come January 1. And I know that our advocacy, when we do Medicaid applications as a firm, we advocate to a point in time, and then we know we're pretty good. Now, the advocacy part of this is really going to be going off the charts. So let me explain what's going on. The way Medicaid is going to be approved is going to be radically changed. Let me start off with some of the basics. They will now require, there's a whole brand new definition. They will require 3 activities of daily living that you will need to have to get Medicaid home care. 3 activities of daily living with regard to limited assistance with physical maneuvering, which they try to define. Try 3. But if you have dementia, such as Alzheimer's or Parkinsonian dementia, only 2 activities of daily living that you need assistance with. So that's new. And how that's going to be interpreted, and if that really doesn't contradict federal law, but that's what is on the books. That's how the Department of Health is saying they're going to be, what they're going to be doing, and it's there. They do have a criteria. It's quite complicated. Then to complicate matters even more, and I know you guys don't want to know about more of the complications, but it used to be that your treating physician would have a huge role in prescribing the home care that you need. What makes sense other than this gerontologist or doctor that you've gone to for the last 5 years or 20 years be the one to look at you who knows you? They're going to a state doctor that doesn't know you at all. And it's going, maybe Maximus, it's going to be just standardized to having a state doctor. So the way you get qualified is radically changing. How you get qualified is radically changing as well. So we have this independent assessor. And here's the kicker, and here's something that it just kind of made me sad, because just when we're getting hit with COVID and all of these losses around us and people getting sick and we're being isolated, and I'm sure you've had or you will do a show on social isolation because it's an epidemic and it's awful. But just when we thought things could not be worse, what do we have as part of this law for home care is an extra review if you're getting high hours, 12 hours a day or more of home care, a review to determine, on its face it sounds okay, to determine whether you are truly safe at home. But from what I see, that review is for the state to figure out how can they get this individual off the rolls of Medicaid home care. So
it's dehumanizing, actually.
It's dehumanizing. If you need 12 hours of care at home, and I'm so surprised they mentioned 12 hours of care at home, because if you need a sleep-in person, they only pay an extra hour, and that's 13 hours of payment. They should have said over 13 hours. Maybe that would make a little more sense. If you need 2 12-hour shifts, a fresh person every day and every night, that's quite expensive. And, and I get it. Maybe that individual might do better physically and maybe even emotionally in a nursing home when there's a nurse on staff almost all the time. But, to set it at just home care level, a 24-hour sleep-in, we have so many clients in that category. It is, Rebecca, that's the word, it's dehumanizing. And then they have to go through even though they've gone through all of these procedures, when you finally get the hours you need, you have to do this again. And I believe it's a way for them to try to kick some people off the rolls. I'm just saying, I'm not saying it'll be used that way, but it is a way to, that is one way that they can use it. And so the procedures, starting January 1 will be very, very difficult. I do want to make mention, even now, though now during the pandemic, I don't want anyone to not apply for the care that they need. We are getting a turnaround, even if it's not immediate need, we're getting a turnaround for our Medicaid home care applications, sometimes as quickly as 10 days, depending on where you live, which is crazy. So we're very happy about that. My advice, please, no matter what the law says, no matter where you're at, if you need the care, get it. Whether you have enough money to privately pay for it, or you want to apply for Medicaid, just get the care that you need. Don't delay. Don't let, what you might perceive as a pandemic right now get in the way of you getting the care that you need.
You use the word dehumanizing, and I think that's not good, obviously, because I think we've gone through a stage here with COVID where dehumanizing has become a normal way of life. You can't bury somebody, you can't be with somebody when they're dying, you can't be with them in the emergency room if they're sick. These are all dehumanizing, in my opinion. And I think we have to straighten out that whole approach with different ways of communicating within that world. And what you're talking about is just a further extension of the dehumanizing part of it. And that's not good. I think we've got to change our approach a little bit here.
Otto,
I think
sorry. Oh, you're so right, Otto. Sorry, Rebecca.
Go ahead, Ron.
Okay, no, I was just going to say, when you mentioned that, I mean, my brother was my best friend, and he passed away, as I said, a couple of weeks ago. And what I found so frustrating and dehumanizing, I did not see him. My brother, my best friend, I mean, we did everything together. I didn't see him for the last 6 weeks of his life. And he was at Sloan Kettering, and it was awful, and it was dehumanizing.
Yeah, I think there's got to be a better way, and they've heard me on this show before preached about this, because I've witnessed it with a few people myself during this stretch. And we have the technology where smart TVs could be in a room, there could be communication, but it has to be the norm. It can't be that I have to suck up to somebody to get a little minute on the phone with somebody. There's got to be a different approach, and I don't have the answers. I don't have the power, obviously, to do anything about it, but I do believe that there's a whole dehumanizing factor that we have to straighten out.
Ron, we thank you so much. We're actually coming to the end. We'll definitely have you back on the show after January 1 when we know maybe what the changes are that's going to entail again. From all of us to you and your family, we're sorry for your loss, and we're very grateful to have had you here today with the information. You've helped a lot of people by being here. We're truly grateful.
So much.
Like what you hear? Here's how you can let us know. Give us a call at 516-299-2626 or email us at info@wcwp.org. Like us at facebook.com/mywcwp and leave a comment or tweet us at mywcwp. We welcome all kinds of feedback. To directly support the podcast you just enjoyed, leave a review on Apple Podcasts. And if you'd like to give back, visit wcwp.org and click the support tab. Thanks for listening from your friends at WCWP.